Hello, 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 hello. I am so excited to be here. I'm so excited. I have such a special guest. I am about to tell you about her, but you don't want to miss this quality time with her. I always have the most phenomenal time when I am on with Dr. Kadisha. I always have the greatest time with you. So,
Ericka.
Thank you. I am so excited to have you on tonight for this special edition of Growth Groove with Dr. Ericka. Now, what makes it special is not that it's Growth Groove and it's on Tuesday night, because it usually comes on Tuesday nights at 7. But tonight we have a super, super special topic. So that's one of the things that makes it special. Plus, I have my super friend, Dr. Kadisha. So I'm so excited to have her with me because there has been so much going on. And I'm going to tell you just a little bit of a story while we wait for everybody to get here, because, you know, the internet sometimes have a little bit of delay of when we start hanging out and when it decides to show us to you. Is that there were two things that happened recently. A couple of weeks ago, I was on the phone with one of my cousins, and he had a lot of questions about the vaccine. And I had an epiphany in that moment that sometimes our views get skewed because as doctors, all of my social media feeds, and you know, social media ends up being curated to you and your interests and your friends, is that my social media feed has a high proportion of either doctors, thought leaders, people that are talking about COVID safety, COVID vaccines, and those kinds of things. So my timeline, especially when everyone started getting their injection, it was like, I got my shot, I got my shot, I got my shot, I got my shot. You get your shot, I got my shot. Here's a video, I got my shot. So I realized that I have information coming from everywhere, just on social media, without turning on the television, without turning on my computer to look at CNN or anything. It's just that information is everywhere. And in that moment, I realized that everyone isn't necessarily surrounded by this wealth of information. The second thing is as a lot of families have done, is that during this time of COVID, I don't know about you, did you end up with a big family group text now? We didn't have this family group text pre-COVID, but we have one now. Do you have one, Dr. Kadisha? You don't have a big family group text?
No, I don't have a big family. That's the only reason why.
Okay, so we had this huge family group text that did not exist before COVID, and we started having conversations, and it just became obvious that it reminded me of the fact that everyone doesn't always have this information. So it inspired me to give my super friend a call, because one of the things we're noticing is that people are so anxious. So as you come in, welcome. Just let me know. Did you get the vaccine? Are you getting the vaccine? Are you not getting the vaccine? Do you have questions? But don't feel obligated, because this is not pressure. We are not doing peer pressure. I want to actually, let's do a couple ground rules. I don't always do ground rules, but we're doing ground rules today. Number one is, this is informational and educational. My goal behind this particular show is that people are able to get some information so that as you have to make these decisions, which can be anxiety provoking, that you make them on facts, not fear. So we are not here to specifically convince you to do one thing, to get the shot, to not get the shot. We are not here to force you to do one thing or another, we're not in this room. We're not going to be doing any shaming. We're not going to be shaming folks for what their beliefs are, whether they believe in it, they don't believe it, they want to get it, they don't get it. This is a safe, non-judgmental space in the internet, at least my little corner of the internet. So the purpose is just to help people get some information, because one of the things I see is that part of the anxiety is because there's between uncertainty, confusion, just almost too much information along with misinformation. So to me, one of the big ways to fight this anxiety is to actually help people have some facts so that the anxiety isn't just from the confusion. So I don't want to do an intro that is forever, ever long, because I feel like this might turn into the super duper extra intro. So let me go ahead and get started. So if you know someone that needs this, or you think would not only enjoy the content or be helped by it, please tag away. Tag folks. Tag at least 5 folks if you can think of. But tag some folks so they can hop in here, get this great information, and also start calming down, because the other thing is, you know what happens when we get anxious and we get stressed? You don't sleep, you get irritable, and you can get fat. Who wants that? None of us want that. So the first thing is you can tag. The next thing is share. So please, if you feel comfortable, share this on your page. I want to make sure that everyone gets this information. One of the things we're doing is we're talking about the anxiety behind it, because we want to do a slightly different spin. The next thing is, if you're watching it later, I am so happy to have you too. No worries. Don't worry about it. Put hashtag replay in there. It's all good. We will make all of this happen. All right. So let's go ahead and jump into it. So thanks for coming. Growth Groove with Dr. Ericka. Special guest, Dr. Kadisha Rapp. And I am your host, Dr. Ericka, Harvard-trained, double board certified psychiatrist and integrative lifestyle coach. I am irrationally passionate about helping people be better so they can do better and ultimately live better. I do that through my adult telepsychiatry program, my books including Fix Your Fairy Tale, A Woman's Guide to a Great Life, Love, and Legacy, and my speaking. The thing about me is I help make mental health practical so that you can get that life that you were created for. Because who doesn't want that life you were actually created for and that you actually deserve? So thanks again for coming. We are about to make all of this happen. So let me tell you about my guest before we get totally into this, is that this is Dr. Kadisha Rapp. She is a top emergency medicine physician. That means that she is on the front line. So I help people stay sane about the COVID. She actually goes to the COVID. So she has a different perspective than I have, because she's actually in the middle of it. I'm fortunate right now. I get to stay in my safe little office bubble. It's not at home. I'm not working at home all the time, but it's definitely a little bit of a bubble. I'm not walking around looking like I'm in a spacesuit part of the time. So, but she is phenomenal. She really specializes in helping people stay safe, not only from COVID, but just in general at home when they're traveling. She just has this huge wealth of knowledge. She also has like these mobile kits which keep you prepared for any kind of emergency that I'm sure at some point she'll tell you about. But since I can't do her all of the justice, I'm going to let her tell you a little bit about herself.
So hi, everybody, and thank you so much, Dr. Ericka, for bringing me on yet again. I love your show. I love your energy, and thank you for bringing me back on, because this is so very crucial. There is almost as much anxiety in the ER as there is COVID. Sometimes I think more so. The anxiety about the COVID is surpassing the COVID sometimes. And so because of that anxiety, like she said, that's just ever prevalent. I've written a book. It's an Amazon bestseller, and it's called Help Us Help You in the Emergency Room. It's what an ER doctor would tell you if she only had the time. I'm a board certified emergency medicine physician. It's been just over 20 years for me now, and my passion. Thank you.
Don't look it.
Thank you so much for that. And my passion is helping people be safer, feel better, and better prepared for emergent medical situations. But in these times also, I want to help people avoid unnecessary ER visits so that you can hopefully decrease your exposure.
Oh, thank you. I feel like I need to have your book in my back pocket all the time. But it's like I keep wanting to remix the title and make it Help Me Help You. Knowing that is not the title of your book. But she brought out such a great point, which is that there's all of this anxiety, and it comes in so many forms, because it's like, is there really COVID? Am I going to catch COVID? Is it really that dangerous? I'm sick of being outside. I can't take it. How can I make it around this? Is this vaccine safe? Why is it out so soon? Is it going to kill us? Is it going to kill the Black people? If I want to get the vaccine, where can I get the vaccine? I can't figure out how to get the vaccine. The websites don't work. I don't even see a website. It says register, but it gets a spinning circle and there's no line. It just goes on and on. There are so many things people are anxious about. And one of the reasons we were doing this is because we realized that some of it is just by getting some basic information will help, release the anxiety, and also kind of talking about some practical coping strategies along with ways that you may be able to get more reliable information. Because since there is so much misinformation that I can't even hardly imagine what it would be like to be trying to look at all of this stuff. And number one, not have had all this years of training to look through the lens, but the other is not only do we have all this training, our phone a friend are renowned physicians. So it's like, phone a friend, and these are the people we're calling. We realize that's not everyone's phone a friend. Isn't that? You can still have great friends and great family. It's just, you just may not necessarily have a main line to some info or someone that did a study and all kinds of stuff. So one of the ways we're going to start out is we're just going to start with some basic facts just to put everything in perspective. The first thing is just that there's a lot of COVID out there, or as my dad would say, COVID. so there's a lot of the COVID. So these stats are from today. So the CDC says they update them at 8 p.m. Eastern. As you know, it is before 8 p.m. Eastern. So these are the stats that were collected at the end of pretty much the end of the day yesterday. That there were 26,160,210 cases of COVID in the U.S. And I know when you look at these numbers, I don't know about you, I'm not used to seeing millions of stuff. So it was kind of almost hard to read the numbers because they almost look funny. And then there were 441,831 deaths. And to put that in perspective, one of the myths we often hear is people are like, well, it's like the flu. Is that, I don't know about you, Dr. Kadisha, and let me know out there if this has happened to you, if during flu season, your social media timeline was people saying they died from the flu or their family member died from the flu.
I'm seeing, it's crazy, but I'm not seeing so much of the flu. I know it's still out there. And, I'm glad you bring it up because all of the viruses, and I tell patients too, because, where I work, we test people all day long for flu, strep, COVID-19, flu, strep, COVID-19. And with the little ones, it's the RSV, flu, strep, COVID-19. And sometimes all that stuff is negative. So I don't, even though we have this number down here, still know that all the other viruses that make us sick every cold and flu season, they're still out there. So don't be surprised if your tests come up negative. But in my circles, it's all about the COVID. My people, my patients, it's all about COVID. It's got to be COVID. Well, what is it if the COVID is negative? It's the other stuff. It's whole families of viruses and other coronaviruses that are still getting us sick. And one thing, Dr. Ericka, in those tests that we do in my ER, I'm almost, it's crazy, but I am seeing more positive COVID tests than the flu.
I'm not surprised. And one of the things that stands out for me is that we've lived through so many flu seasons and people will be like, oh, I caught the flu. But like, I can go through my Facebook timeline, just for instance, and it's like, my mom died of COVID. Someone died from COVID. My friend died from COVID. This kid died from COVID. And just analogous for flu season, we know there are typically some flu deaths, nothing like what we're seeing now. Right. But I think it puts it in perspective that you're not this like 0 degrees of separation from all this death during flu season. So I think in that way, it kind of puts it in perspective that this is a different experience. It's a different bear.
Yes, and COVID is said to be a bit more contagious than the flu.
And then on top of it, like we've usually been saying throughout this whole thing, is the numbers are usually lower than our actual, because they're going to be people that people suspect have COVID that they didn't test, especially earlier when the tests weren't readily available.
Yes.
When typically they were primarily testing people that were either really sick. Well, really, they were testing people that were really sick that they didn't think were going to die.
Mm-hmm.
And so you missed a bunch of people, but then also depending on when people test in their illness cycle, they're testing negative because it's before they have enough.
Before they convert from negative to positive, yes.
And then there are times where people will have what we say a presumptive positive. They have all the symptoms, and then either someone doesn't test them or they tested negative, but most likely they still have it because some of the tests, especially the rapid tests, have a significant false negative rate.
And to that end, I have seen my share of people who had that the CAT scan, the chest CAT scan and chest X-ray findings, and we have a negative rapid antigen test. I am seeing that. So you're quite right about that false negative presence.
So I think that takes us to one of the reasons people are anxious is because this can be scary, and it's causing some significant lifestyle shifts, which just makes it anxiety provoking. And we know that there have been a few interventions that everyone has talked about as far as just general precautions, washing your hands, wearing masks.
Yes, indeed.
Distancing, all that kind of stuff. And then the vaccine came out, because one of the things I think a lot of us, ideally, you want to be in a position where you prevent COVID and don't get it. But naturally, because of number one, just because we're in the middle of a pandemic and a vaccine comes out, and there's just so much information, and the internet does what the internet does, which means that we're not surprised that there are having things happen, that people have anxiety around the actual vaccine. So we're going to show just a quick vaccine stat. So they have given out this, and this is of 6 a.m. this morning, 32,780,860 total doses. Can I have that much money? Can I have $32,780,860? That's what I want. And of those doses, 6,064,792 people have gotten 2 doses. So that group of people are the people that have gotten the full set of doses of the current vaccines, because the current vaccines that are approved in the United States have 2 doses.
Yeah.
So those are the people that have completed their vaccinations.
Right. And I got my second Moderna dose yesterday. And I think, like someone in the chat, I got my first and second doses, no side effects so far, but one thing I'll warn people about is that I took ibuprofen and Tylenol like shortly after I got that second dose. So not to jump ahead, but
I get my second dose tomorrow. And I think this is a good spot, because I don't want to feel like we're so stat heavy, we stress you out. Is I get my second dose tomorrow. And I think one of the things that's important to keep in mind, and even as physicians, is that information continues to change. So the personal decisions we are all making about whether not or when we're going to get vaccinated, if you choose to get vaccinated, if you choose not to get vaccinated, if you're like wait and see, or what you decide to do, especially for a lot of physicians, there have been things that have changed, that may have changed feelings of urgency or feelings of comfort
Yeah.
around the vaccine. I think that's something important to talk about, because I think that may kind of help people understand kind of what we were thinking, because a lot of times they see people getting their shot, but they might not know the thought behind it. So what were some of the things you were thinking about when you decided that you were going to get vaccinated?
Okay, well, I'll admit my first thoughts were that I would wait and see, and hear about the first wave of people getting their,
That was me too.
as charged. But then I go to work and I'm exposed to a whole family that has COVID-19. And then, days and days go on and I hear, of very rare allergic reactions, even more rare anaphylactic reactions. It was, I think it was said last week of December, maybe it was like 11.1 anaphylactic reactions per million doses. And then 1 in 100,000 people had an allergic reaction. And I'm like, well, shoot, my chances of getting COVID are a lot higher than it is of me having an allergic reaction. So I was like, so that the urgency came up. So the hesitancy quickly changed to urgency, because it's like, well, I can wait all I want, but I got to go to work and be exposed to COVID-19 like tomorrow. So once the Moderna vaccine was made available to my company, I jumped on it. I just jumped on it because I looked at the odds, and I looked at the odds of, the reactions to contraction of COVID-19. It's like, and even with the side effects, I was like, all right, what about the side effects? The side effects last a day or two. COVID-19 can last weeks. You can have long-term effects for months. So again, I jumped on my opportunity to get the vaccine.
And I have a similar story, which was I was originally in the wait and see camp. I was like, well, I'm pretty comfy in the house. I'm like, I got allergies. Let me see, because originally we just didn't have a lot of the information, but we knew that I had some friends that had done some studies, but I was like, I'll just kind of chill back. I'll let the first wave go and see what happens. And then COVID didn't get any better. So I think the first thing is when we were all having these thoughts initially, we were thinking it was going to get a little better, not to continue to get worse.
Yeah.
And then they started having these resistant strains. And then you started realizing that at some point there might be a shortage.
Yeah.
And then I think the other thing for me is when I shifted was after they started giving out the vaccine. And number one, I started seeing what people's practical reactions were.
Yes.
That were also people of color like me.
Mm-hmm.
And then by the time I'd gotten it, millions of people had gotten it. So I got mine the first week of January. So the stats were out. Well, to know that a very, very small number of people had a severe reaction, it's like knowing, I felt much more safer than it only being the studies, because by the time I got it, millions of people had gotten the vaccine. So you knew millions of people got it and they didn't drop dead.
Yes.
And I was like, where can I sign up and get mine ASAP? Because it was just one of those things that you just didn't quite know what was going to happen with everything else. And especially as these new strains started coming out and it became obvious also, I'm in a city or a state that is not closed down. I'm in Georgia. So as people are talking about, we haven't been able to eat in a restaurant forever. I'm like,
in Texas,
we've been eating in restaurants for almost a year here.
and just like Texas is special also. As you said before, Texas is special also. Nothing has really stopped. They're doing live music at restaurants. Strip clubs and nightclubs are starting to serve food so that they can stay open. yeah, nothing's changed down here. So another reason why I jumped on getting the vaccine, because things are not getting better.
Yes,
Yeah.
and I think that's one of the reasons we wanted to do this, is not to tell you you have to get it because it's a miss, but so that you have some real information to base your decision on, to base what risks feel comfortable for you.
Yeah.
Because I think at the end of the day, for me, I felt more comfortable with the risk of the vaccine than the risk of COVID. But I don't have any huge medical conditions. I am mature, but I'm only so old, but I realize it's still a very personal decision. But, I like people to be open to the experience that a lot of us have had, that what you feel at one time as information changes, how the decision is made may change depending on how things go.
Yes, 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 indeed. And then also, like you were saying, it helps to allay that anxiety with a little more information. Folks just know that you're not in the vaccine getting the live virus, or even a weakened or inactivated version of the virus. You're not getting that, at least not now. The Moderna and Pfizer are these messenger RNA vaccines that teach our cells how to make a protein. Or maybe just a piece of protein. So it's not the live virus. But I mean, hey, you can keep watching me. I'm on I think, yeah, maybe the first 24 hours after getting that second dose of Moderna. Look at me. I'm fine so far. Okay. But, folks are getting those headaches, fever, chills, and body aches. But, if you're worried about getting it, and do get the second dose, because you're only a little over 50% covered with that first dose. You don't get that 93 or 94, 95% coverage until 2 weeks after your second dose. So so definitely, don't think that after getting that first dose, and there is concern about people returning for the second dose. They say that human compliance, just based on previous experience, I think maybe about 40% of people may skip any second dose or third dose of any series of vaccines. So definitely know that number. You only have half the coverage if you only got one out of the 2 doses.
Yep. I mean, it's definitely an adventure. And right now everyone's getting Pfizer and Moderna. We do know that there's now talk about the Johnson and Johnson vaccine. I don't believe it's been approved yet. But there's talk that it should be approved relatively soon. So I think the other thing is, just as I tell people with just general COVID information, is that this is a great time to kind of talk to your brain trust and kind of figure out what are going to be your reputable sources of information, and kind of come up with like your top 5 list of, if there's a specific website that you feel comfortable that the information that they're going to give you is safe, or a certain TV channel, and, a couple of people that you feel like you can talk to, or, if you feel comfortable talking to your doctor, or just a top 5 of reputable information. Because what I don't want to do is, my fear, I'm going to be honest. Is it okay if I be transparent for a moment?
Yeah.
One of my biggest fears is that we make decisions based on fear, and then end up with outcomes that could have been prevented because we would have made a different decision with information. Because I don't want to get into better, best, or judging people's decisions. But I just don't want someone to make a decision that they're like, well, Tuskegee, I'm not getting it. And then end up with a bad outcome and then be like, oh, if I would have known this is how everything worked, I would have made a different decision. I just want you to make a decision that you can feel confident with in the future, so that it, 1 year, 2 years, 3 years, 40 years down the line, that you're comfortable with the decision you made because you made it off of reputable information, because there's a lot of conflicting information. People, as I said when we talked about the intro, it's kind of like Tuskegee. And it's Black History Month. So, we both are Black up in here. Is that happened? It was horrible. There is fact-related basis for a lot of the anxiety and mistrust that the Black community has with health and also the government. I think for me, one of the things that made me feel a little bit better about this is there's no distribution that's going to be just to Black folks so that we can get special files.
Right.
And I think that's one of the things is it's just not distributed that way, that there's really a good way that someone could specifically give something that's going to harm us and not harm anybody else.
Because it's affecting everybody. With Tuskegee, it was just us, or it was just our, it was just Black men who were suffering from this. But this is proving this is a universal condition. Big difference.
And it's a universal rollout, so it's not like sitting in an office and people are coming to an office, you're getting something and then something totally different. It's just not the way it's given. But, the thing I'd like to ask people is if you're feeling anxious or you're concerned because you feel like the government or medicine may be doing something to harm you, or that it may not be something that's safe for your population, be it you're Black or you have another identifier that you feel like may be uncomfortable, I think it's worth having a conversation with a doctor or some experts, or just looking up some information for yourself to really get an idea of what is historic and what is current. Mm-hmm. Because I think one of the reasons a lot of us are passionate about this is there are already a lot of health disparities that are affecting the Black community, also including things that cause the Black community to be significantly impacted and disproportionately impacted by COVID. And I think the thing we don't want to have happen is that our community becomes disproportionately further affected because of the ways we interpret different interventions. And, I have a cousin that mentioned that there's got to be some other way to manage. And I think the difficult thing right now is there are just limited things. And I look at it, when COVID first happened, I went back and watched all the apocalyptic movies. So I watched Contagion, I watched Outbreak. I think I just didn't watch I Am Legend, but I watched a whole lot of apocalyptic movies with viruses. And there also was like this Netflix show that was really freaking good that I watched pre-COVID. And the thing you see always in these, which is happening now, is that, people are trying to decide, am I going to risk getting sick and possibly dying or take this vaccine? And unfortunately, we're at a place right now where it's not getting a sinus infection. And we know if you take one of 2 or 3 antibiotics, there's a 98% chance that you're going to be straight. That a lot of the treatments with COVID, even though they have shown some improvement, is that there's a lot of it that's just a toss up of what ultimately is going to happen.
Can I just touch on something there, because you bring up a really, really good point. Do you know what it's like to have someone test positive for COVID and see the ground glass appearance in both lungs on the CAT scan and have not anything specific for COVID to treat them with? And because at first we were relying on, well, maybe Zithromax will help, what you use for your sinus infections, ears and bronchitis and all that. That's not, now they've taken that back. They took that back long ago. That's not going to help. Now we're relying on something called the Eye Mask Plus protocol, and it sounds technical, and I'll type it in the chat here for you, Dr. Ericka. But it's basically vitamins and a medication called ivermectin, which was initially used for parasitic infections. That's what they have. We've got zinc, vitamin C, vitamin D, I think maybe vitamin E or A, and a medication called ivermectin. And you can only use it on days 1 and 3. So, and a lot of people come in, seems like they come in on the second day of symptoms. So I'm like, well, you missed day 1. We can try it for day 3 and see if that helps you. But that's what they have right now. And the remdesivir and things like that, that's IV, and steroids. You might have heard about that. That's tempting to give too. But if you have a mild case, they say, nah, it really is. And some doctors are just doing what they feel is right, because we don't have anything specific, or if there are specific treatments, they're only recommended for severe cases, people in the hospital on IVs.
So, I think that brings us back to the point, is probably one of the reasons there's so much intense debate and conversation and urgency around this vaccine. Is a lot of the urgency is because there's not as much definitive treatment, which kind of makes you feel like there's a limited amount of options, because you're trying either not to catch it or not to catch it. and it's still an infectious disease that one of the only ways not to catch it is never to see a human being and never to go anywhere. Yeah. There's always, you can take all the precautions and there's still some level of risk. And I think for everyone, it's still that moment of deciding what is the risk that you're comfortable with. I do want to encourage people, if you have any questions, I don't always have Dr. Kadisha with me. So, if you have some questions, it looks like we have one about blood plasma.
Yes, there is that treatment, and the convalescent plasma therapy has really turned things around for people. Again, it's in the severe, like almost critical hospitalized setting for which that is used. The convalescent plasma is not used for the majority of people who have COVID. If it was used for the majority, there'd be a great shortage of it, because that relies on people donating plasma who've gotten over the illness as well. So yeah, that treatment, convalescent plasma, is done wonders for people. But again, not for Joe Blow who's out here managing their COVID at home.
And I want to take a quick moment. I know I mentioned kind of figuring out your top 5, and I want to just have a quick conversation around some reputable places to get decent information. I know a lot of us go to the CDC website, and I have to honestly say, I feel better about the CDC website after the election. I feel a lot better about it now. But as far as just a comprehensive amount of information, that's a place that typically has quite a bit. Yes. Another place, because I know people are also dealing with a lot of, a colleague of ours, Dr. Kwame, says big emotions. But people are having big emotions related to the pandemic, related to what to do about this vaccine, and also trying to help their children deal with all of the changes and the stress. So some other good places to get information when it comes to dealing with some of the mental health aspects of managing this include the National Alliance of Mental Illness has some really good information. Also, the American Psychiatric Association, so psychiatry.org. And I'll probably just need to put something in the comments when it's all over with some websites. But I know those are some I really like. There's also one that has some really good infographics for kids, but for some reason it's off the tip of my tongue. I'll put it in there. But are there any specific resources that you would point people to get some good information so that they don't feel quite so anxious because they have some facts, Dr. Kadisha?
I totally agree with you. The CDC is probably like the premier source of information. Also, and I remember this from my, I actually was working at the CDC during the anthrax scare, and we were telling people to call your local and state health departments. So, if you want to, talk to somebody, consider calling your health departments. Again, your primary care physician. If you don't have insurance or you don't have a primary care physician, most cities or in small cities have, and maybe even small towns have a healthcare system in place for the uninsured and for the uninsured. So don't just give up because you don't have insurance or a primary care physician. There are city clinics and county clinics and health facilities that you can go to also that are just filled with information to give to the general public.
Right.
Also, the FDA has, they also put out their own statements about the vaccines as well.
Okay. And you brought up something really good, and something I've been telling people to do also is, if you're on social media, this is a good time to follow the health department. Follow the health department because a lot of times we're finding that they may have updates and resources, information, especially when it comes to COVID testing and vaccines, that are not necessarily getting updated real time on their actual website. Because I know there's been also quite a bit of anxiety around, I want to get the vaccine, where do I get it? Because there's so much confusion. But one of the things I recommend is follow your health department, because a lot of times there'll be information there, and also looking up, sometimes on those websites, they'll have places to register. Like I did, I looked it up for my father.
Mm-hmm.
So a place in San Antonio where he could register and check with your primary care. Because I know part of my family, the health system that their primary cares are in, they have something called My Chart, and they said if you were interested to register, and then they contacted people. So a lot of times it takes just a little bit of persistence.
Mm-hmm.
But if you start having problems and you reach out, and then usually sometimes you need almost like a little town hall, phone a friend, a couple of people to put their heads together around a practical solution.
Yes, indeed. And also another thing is COVID hotlines. Before you might not even have to go to your local clinic or health center quite yet. Maybe try the COVID hotline first. Like, for instance, here in Houston, our hotline is 832-393-4220. I got it memorized.
What was it again?
For Houston, COVID hotline, the COVID-19 hotline.
I'll type it for you, but I see you know, it's okay. I'll let you do it.
Okay. This is where you can find your testing sites and your and information on vaccines as well. Some of the same testing sites may also be sites for vaccination as well.
Okay.
And I'll admit, I work in an ER, but if I want to, if I feel the need to get tested, I just drive over to my local testing center and sit in line in my car, and they text you the results. A lot of these places, you don't need an appointment, you don't need insurance. So also don't be intimidated by what you think you might need to go get tested or vaccinated. Sometimes it's just a matter of just driving up there, because a lot of people are going to self-eliminate and be like, oh, I'm sure it's a lot to it. Just drive up there and see what's going on. They want to test people.
Mm-hmm.
They want to vaccinate people.
Yeah, I mean, and I do the same thing. I actually live walking distance from the health department. So that's actually where I get my tests, because they do PCRs, and it's a situation. But, you know, I think part of it is learning where some of this information is. And, you know, I don't want to keep you here forever and ever. I also know Dr. Kadisha probably has some work she has to do.
I always enjoy you, and this is such good information. This was such a great topic. So
thank you. And I want to just give a few practical things. One being, number one, there is so much information. There is so much potential info overload that if you start feeling tense or on edge, take a break. Woosah, turn off the news, turn off your social media. Just take a little bit of a brain break. Sometimes you just have to turn the noise down. Make sure you're still taking care of yourself and drinking plenty of water, getting sleep, and not just having COVID snacks. Don't forget to breathe. It's so simple, but sometimes we have to just slow down and breathe. If you start feeling like you're feeling anxious or overwhelmed or embroiled in some deeply contentious or passionate COVID vaccine discussion, sometimes you just got to slow down and take a few deep breaths, 3 to 5, and just slow it down. And then also know that, accept the fact that everyone's not going to agree with everyone. Everyone is not going to agree. Everyone is not going to have the same opinion. Everyone is not going to make the same decisions and choice. And there's a point where you have to respect everyone's autonomy, that everyone has the ability and right to make whatever decision they choose to make, and be able to let it go if it is not the same one that you choose.
Definitely.
Are there any kind of lower your anxiety pearls you got up in here, Dr. Rapp, Dr. Kadisha?
Oh, let's see. Just regarding the vaccine, I can't say it enough. You know, you can take it from me. I'm a day out from getting the second dose. I weighed the odds of me catching COVID versus the odds of having a reaction to the vaccine, and it was an easy decision. Just having that protection, that allays a lot of anxiety. Just even after the first dose, it does take 2 weeks for your body to mount that response, but I immediately was started to breathe easier once I got the vaccine, and knowing that other physicians were getting it. You know, my chief medical officer gave me the vaccination both times. There's a channel on Instagram of nothing but Black doctors photographing themselves, sending pictures of themselves getting vaccinated to help reduce that anxiety and distrust caused by the Tuskegee experiments. There's tons of doctors on there every day getting vaccinated. So that was definitely a pearl for, helping me allay anxiety as I waited for my opportunity to get the vaccine.
Right. And, so I think it's just important to keep some practical matters in mind. But I do think it's huge to just, sometimes you got to boost up. And as they say, as a different world, relax, relay, release.
Relax, relate, release.
Or circa Martin Lawrence, Bad Boys.
I forgot that one.
Sometimes you just got to take it down. We realize that we're making decisions about things that are serious. But I don't want you so stressed out that you make everything 10 times worse. Oh, and then we have one, naturally people start sensing the wrap up. So what advice do you have for the elderly? Do you want to kick us off, Dr. Rapp? Dr. Kadisha, I never call you Dr. Rapp.
I know it's just so easy. It's easier than Dr. Kadisha. I understand. So for the elderly, because I know I have elderly friends who are asking me about how to get the vaccine. And I just advise, and I'm sure our elderly family here already know they're already being safe. They're already keeping their health conditions in mind and keeping the grandkids away. I've heard about the grandmas who are making the food and putting it on a table out on the driveway. Things like that. Just continue to be safe. Stay in touch with your primary care physician. Get in touch with your state health department because, over a certain age, you are amongst the priority groups. So stay on those health departments. There are websites that your city or county may have for you to register to get in line. My mother registered up in Maryland, and she's waiting for her turn. So there are a number of things you can do. And if you're not that tech savvy, ask a young person in your life or in your neighborhood, in your building, somebody's grandson, somebody's son or daughter to, help get you registered on these websites to get on the wait list.
Well, and I think you bring up a huge point, which is, we're all going to get through this together. We're going to get through this as a tribe. We're going to get through this as a community. So one of the first things I think that you said was huge is that if someone is older, they're not tech savvy, or you have a loved one that is older and they are not super tech savvy, that you volunteer to help them out, that, you're searching and stuff too. And the next thing that Dr. Kadisha said that was very important is naturally, beyond the fact that we're doctors, but we're not your doctor, is that most of the time, a lot of the time, that your personal doctor will know if there are any specific conditions going on with you that would potentially impact the safety of getting a vaccine, that would guide your vaccine choice due to safety. So I would encourage anyone to reach out to your doctor. And if you don't have one, quite frankly, this is a pandemic. People are answering questions. I've been taking consultations on people I knew for sure would not come into my practice, but I knew they needed some help and needed some referrals. So I still did the consultations, even though I knew they weren't going to fit for my practice, but I want to make sure they get some help. That, if you don't have your own doctor, or you don't, you can do, like Dr. Kadisha mentioned, like calling the health department. There's a time a lot of people do have some form of coverage, is that even if you haven't identified a PCP, or you may not have even seen them yet, you can still call the office.
Definitely.
I mean, this is a time where I feel like people are really, really pitching in. But I think the first thing is, if you have a doctor, just to ask, for most people, because they're elderly, that the average answer probably is that there is some concern that it would be helpful to get it due to being in a high risk group. But just making sure that there aren't any specific medical conditions that would make it unsafe.
Yes, and if you've gotten a vaccine for something else, say it's the flu or shingles or something like that, know that you're gonna need to wait 2 weeks to get the COVID vaccine. Or if you've gotten the COVID vaccine and you're worried about shingles now, you're going to have to wait 14 days to get back the other things that you can. Because I do like to promote the fact that, while you're waiting for the COVID vaccine, there are plenty of other things you can get that'll help keep you well and out of the hospital. There's flu, shingles, the pneumovax. Elderly folks, make sure that you've gotten your pneumonia vaccine. I know you only get it once every few years. Is this your year? While you're waiting for that COVID vaccine, get that protection as well.
Thanks. That is a phenomenal point, because one of the other reasons I think we want people to be able to make these decisions one way or another, and take in mind when you make this decision, as I say, you often hear people in Atlanta say, "We're full. Nobody else can come to Atlanta. We're full." So
Yeah.
that's the deal with the hospitals. Hospitals are full. ERs are full. ICUs are full. A lot of them, the hospital floors are full. So this is a time that COVID, no COVID, you need to take care of yourself, because no matter what is wrong with you, there might not be some place to put you.
Oh my gosh, yeah. And yeah, that's like an understatement. Houston, we've got the medical center. It's like one of the biggest medical communities in the world. And on any given day, it doesn't matter what I'm calling for, the entire medical center may have no beds for my ER. So for whatever reason, do whatever you can to be well and stay out of the ER, stay out of the hospitals. And if that means covering yourself for shingles, covering yourself for pneumonia, covering yourself for the flu, do it.
I mean, and this is a great time to get active. It's a great time to explore healthy eating, because this is a time where the variables we can control, we need to control them, and as we remind people, if your chest is tight, your face starts drooping, you can't talk, and you pass out, go to the emergency room. We don't want anybody staying home because they're afraid to go to the ER and they have a heart attack at the crib.
And another thing with that, I work with the City of Houston EMS, and I've worked on the other end at the ER, of course. If the paramedics try to discourage you because they don't want to transport you, don't allow that. If you feel you need to be transported somewhere, don't let them talk you out of transporting you. It's just a little something I'm just sliding in there, trick of the trade. They may try to convince you to stay home, go to your primary care doctor, try to go in by car. If you are sick, you are sick. If you need an ambulance, you need an ambulance, and don't let them talk you out of transport.
Thank you. So that is a great note for us to start the wrap up again.
Yes.
Wrap up part 2. Did you just do the wrap it up box?
I'm wrapping myself up.
I was like, I think she did the wrap it up box. So are there any pearls, big messages, takeaways you want folks to have?
Just be safe, be well. And like Dr. Ericka said, there are still, I know that you feel like you have no control in this, but there are still variables that you have control over. And so, manage those. Those make a big difference as well.
Thank you so much. So tell them what they can find when they look for you at this website down here.
So at drkadisha.com, you'll see a PowerPoint presentation that I did on 10 ways to be safe and well during this pandemic. Also, the chance to get one of my mini mobile MD kits, which are made for like the cold and flu season. And especially since now that they're advising that we wear 2 masks because of the variants, my mini mobile MD kit does have the surgical mask and it has the cloth mask. In addition to gloves, sanitizer, even forehead thermometers. If you're, out at the grocery store and you feel a fever coming on, you've got a thermometer in your bag. So you're covered. And you can get that presentation and more at drkadisha.com.
You have me now feeling like, I need to keep a thermometer in my pocket like a holster and be like, people start walk too close to you, be like, what's your temperature?
Yep. And there's one for you and one for a friend. So if you're there with someone and they feel like they got something coming on, you got one for them too.
Well, thank you. I am so blessed to have the most fabulous Dr. Kadisha on with me. I'm always so, I feel like I'm one step away from going, Hercules. I'm just so excited to have you with me. And I'd say if I had to say what my takeaway or pearl is, it is sometimes you just have to take a step back, breathe, and come up with a practical strategy. I'd say the biggest I'd say my biggest I'm about to say fade away. Why am I moving into basketball? Takeaway. I think the biggest one is we were talking about is just identifying a few high quality sources of information. And in that, I'd say top 5 and included sources of information, but also one person that you can ask for help if you have difficulty navigating a situation, a system, figuring out a strategy, someone that you know that is tech savvy and reasonable.
Mm-hmm.
That can just help you out. I think that would be huge and would make such a huge difference for you, because it just helps decrease that anxiety by helping you feel that you do have some resources, you're not alone, and you're not just trying to figure out all of this by yourself. The other thing is, I meant to mention it earlier, it's something totally random, but I'm here for the randomness as we do the wrap up, is I don't know if you have heard of Clubhouse. Now I got to give a disclaimer. There's some of everything on Clubhouse. So if you don't know, Clubhouse is a new social media, but it is only active you can only use it from basically Apple platforms like an iPhone or iPad. It's all audio, but it's interesting because you have access to this really wide variety of people. And there's some COVID information that's actually really good. Now there's some that is total quackery, and I will just say it's quackery. But there are some, it's interesting because you'll have the opportunity to hear from virologists, microbiologists, epidemiologists, public health experts, doctors, some of everybody. And it's people that you may not have access to in your circle. So I found it a very unique place for information. It's just you have to have some level of discernment to figure out where is the reputable information versus what might be snake oil. And I will leave it at that and just say I really appreciate you all coming. If you know anybody that needs this, feel free to tag or share. If you're watching it later, you can always come back, start over, or hop in wherever you'd like and just put #replay in the comments. If you have some questions or things pop up, just stick them in there. We'll check in. If it's at a time that it's later and Dr. Kadisha is not cruising the Facebook, I will hit her up so that we can try to get you some answers, because, I think everyone's going to make it through this. We're going to make it together. We're going to make it through this together with love and with grace. So I want to leave you with, you have to do your normal prescription, call at least one person and tell them that you love them. It will make them feel better. And I bet they will tell you they love you too. I got to give big ups, virtual hugs over there and spirit fingers for Dr. Kadisha, because I can and because she's great. And also encourage you, I am running my Define Your Vision Board. I can't talk today. Define Your Fairy Tale 5-day vision board challenge. It's a free challenge. It's a vision board challenge. I'm so excited. You can register at visualize21.com. As I said, it is free. It's 5 days because it's designed for busy professionals. I want you to be able to successfully complete it. Sometimes when you do something in one day, if you get busy that day, it's hard to do all of it. And this gives you plenty of time to make sure you have your supplies, that you're able to put your vision board together, and then also to learn how to make your vision board actually work for you. So I want to set you up for success. So you can register at visualize21.com, visualize21.com. I look forward to having you. It starts on February 15th, so you have a little time to get a little breather, but the sooner you register, the sooner you get the workbook so you can get all your stuff early. So thanks again for having me. Thanks for spending quality time for us. Thanks for trusting us to provide you with good information. I look forward to seeing you again. I will be on tomorrow night at 7. Let me know if there's something you want to hear about. I haven't quite decided what I'm talking about yet. Being transparent just for now. But I'm going to let you off the hook because now I am rambling. So have a great night. Thank you so much and stay safe out there. Bye-bye.